Welcome to Startup Success, the podcast for startup founders and investors. Here you'll find stories of success from others in the trenches as they work to scale some of the fastest growing startups in the world. Stories that will help you in your own journey. Startup Success starts now.
Welcome to Startup Success. Today we have two exciting guests in studio. We have Dr. Tara Bishop and Eileen Tanghal, co-founders of Black Opal Ventures. Welcome to the studio.
Thanks, Kate. Pleasure to be here.
Thanks, Kate. I'm excited to speak with you both. Black Opal Ventures caught the eye of my producer who was doing some research, but let's start a little bit with the two of you. From my understanding, you met at MIT?
That's right, Kate. Eileen and I have actually known each other for over 30 years. We met within the first week of us starting undergrad at MIT and have stayed very close friends and confidants throughout our careers. So have a long history of knowing each other essentially our entire adult lives.
Oh, that's great. Talk about coming full circle. And now here you are with your own fund. So before we get into Black Opal Ventures and where you're focused, I'd love to learn a little bit about both of your backgrounds and what led you back together. Eileen, do you want to start and kind of walk us through?
Yeah, so like Tara, I trained as an engineer at MIT. So I studied electrical engineering and computer science in college. And right after college, came to Silicon Valley and joined an early stage venture capital backed startup company. And I was one of the first 10 employees there. We had less than $1 million in revenue. We're still trying to find our product market fit, our long-term business model, and had the benefit of seeing that company go from, again, what was less than $1 million in revenue to a $100 million revenue company that went public. So I had a very early experience of a successful VC-backed company. And then I got into another startup during the .com, which didn't go so well, raised like hundreds of millions from, at the time, SoftBank and others. And so what I like to say is I was at a successful one and then a not so successful one, which is really good for then to pursuing a career in venture capital. After that, I went to London, studied my MBA at London Business School, went there because I wanted to be a product manager. I wanted to continue down this road of being a product manager and really learning the business side of tech companies. And really out of nowhere, I was selected to be part of this venture capital summer associate program. And that started my career in venture capital. So I've been a venture capitalist now for what is about 22 years. And I've had all sorts of different roles within VC, starting as a financial VC in London, then a corporate VC in the Valley at big tech companies, then a VC for the CIA, and then, of course, now launching the fund with Tara. And what I can say is in my VC career, the successes I've had are always when two different areas come together and collide. So really, starting back in 2014 and Applied Materials, when I was running it, we're very early investors into a successful company called Twist Bioscience, was colliding semiconductors and in that time, gene synthesis.
I like all the different investing experience you've had. And then the fact that you've been on both sides of the spectrum with your startup experience. I think a lot of listeners can relate to that, right? I can see how that would add to, as you approach investing now. Tara, what about you? What's your background?
So as Eileen mentioned, we were both engineers in college, and I did study engineering, but then actually decided to go to medical school right after university. And so I took a very different career path that was straight to medical school that actually had quite a bit of sort of a prescribed career path for the next 7+ years of my life. So 4 years of medical school, 3 years of residency, and then a series of fellowships, which is just all part of training in medicine. But it is interesting, one of the things people often ask me, like, what drove you to have what I consider a very wavy but interesting and impactful career path. And it probably actually started in the early 2000s when I was a resident and treating patients in a system that I felt was very, very broken. It was a time when we had nothing digitized in healthcare. We had very poor access to care with a lot of people who were uninsured or underinsured. And it was just hard to work in a system that felt that broken. And so I think many of the career choices I've made in the past 20 plus years have been really to try and improve that healthcare system. So I started my career, as I said, in clinical medicine. I spent the first portion of my career in academic medicine. I was a professor at Cornell Medical School full time, working in the Department of Healthcare Policy and Internal Medicine. And in that capacity, I saw patients, I taught medical students and residents, and I did a body of research around access, quality, and cost of care. And that really kind of opened my eyes to the larger picture of healthcare. A lot of interesting things were happening at the time, particularly the Affordable Care Act, which was being passed at around that time. And all of a sudden with that, we were having not just a lot of new people who were getting insured, but a lot of things in those bills that bill in particular that was driving changes in the healthcare system, particularly around an area called value-based care. I had an opportunity to actually move over to the private sector about 8 years ago and became the medical director at McKinsey. And in that role, in a consulting role, we were really working with our clients, both hospital systems, payers, government agencies, to really navigate this new and burgeoning world of value-based care. And so I spent a lot of work with clients, not just in the area of value-based care, but how do you actually use data and analytics to drive value rather than volume in healthcare. I, like Eileen, probably later in my career, had an opportunity then to join a startup company. And so Eileen and I both have startup experience, and I became the chief medical officer at a startup health insurance company called Bind. And Bind was actually trying to take this concept of value and data and analytics and technology and really change the underwriting model of health insurance. We built that company from the ground up, ended up selling it to an acquirer, and had an amazing experience building a healthcare startup. And that was really my sort of. There was a decision point at that point of, what do I do next? Do I stay with a larger company? Do I go back to clinical medicine? And we ended up having an opportunity to actually launch Black Opal. And it has been, I think, one of the most exciting and best opportunities of my career so far. And so I might actually turn it to Eileen if you're interested in perhaps sharing a little bit of how we got Black Opal off the ground, if that's interesting to you, Kate.
Yeah. I mean, you brought us right there. That was where I was going to go to next. And I just have to tell the listeners, you've raised $63 million so far. So congratulations. That's quite an accomplishment and says a lot about what you're doing. So yes, Eileen, if you could take us there, that would be really interesting to hear.
Yeah. So as Tara mentioned, we've known each other for a long time, and we have remained close confidants and friends in that entire period. And I like to say that, that really makes a difference, of course, when you're deciding to start something like this. It's so important that the partner you choose, that you're aligned and know each other. But it started really as a concept that we had in one of our yearly get-togethers. So Tara and I and a group of our other friends from college get together on a yearly basis. And we were in 2019 with one of our friends who was running a big division of a pharmaceutical company, hiking up. It's not a mountain. We like to say mountain. It was actually a hill, but I'm joking aside. We were actually all going for this morning hike, just talking about what we were doing at work, right? And I was, of course, in the middle of making investments for the CIA, for the defense intelligence industry. And I was sort of explaining the problems that they faced. And Tara started talking about what she was doing. And it turned out, right, machine learning, AI, quantum, etc., there was a big overlap in the problems that the defense intelligence were facing. And then, of course, what hospital systems, insurers, payers, providers are facing. And we had an aha moment right then in 2019 and decided to launch effectively an angel investing group amongst us, which, few people know, but I think we've now made it more known. We called it Phi Altus. Phi standing for like sisterhood, and Altus because we were climbing up a high place at the time.
Nice.
So we started this Phi Altus investing group, which was really this, let's find companies at the collision of tech, and specifically tech in this case, that was for collecting information, interrogating information, analyzing information that the agencies and defense intelligence were using and could be relevant in healthcare and life science. So that was our thesis as angel investors. And that's what we did. And so how did we get here? Well, as Tara mentioned, we had this opportunity backed by our anchor investor, Eli Lilly, to start this fund and take effectively what we were doing with our own money and make it into an institutional backed fund, which is what you see today, Black Opal. And we were presented with this opportunity. We had to think very, very hard about it. We were very lucky and grateful to Eli Lilly and the folks there for encouraging us to take the risk. Because as you can imagine, we were both perfectly situated where we were, and we both felt we were doing important mission-based work, right? Tara was completely improving healthcare. I was investing on behalf of the defense intelligence for national security. So why would we leave our posts, take a risk? And I'm going to stop there and say, we each had to think hard about whether we were going to do this. And we took a couple months to consider it, and then decided that we could still accomplish our personal missions and be sort of a representative and someone who could inspire others. Or, maybe that sounds a little bit arrogant, but we felt like we could make a difference if we did Black Opal, and we could still make a real impact on healthcare, on an important problem statement, and inspire others, include others to do the same with Black Opal. And so that's what we did, but it was a long journey from this is our side thing that we do to this is what we do 100 times.
I can see where that would be, somewhat of a transition, right? Because it's such a big step. Like you said, you both were accomplishing a lot in your full-time posts and had a lot going on, and we're doing very rewarding work there as well. And this is a big step. So I can see where you have to really think through making that transition. How has that been, Tara? Now, you got to the point where you're going to make that transition. You commit to that. Can you walk us through, kind of the early days to where you are now? And that would be great to hear.
Yeah. So it's interesting to kind of, I often tell people it's probably good I didn't know what I didn't know at the time, although I do think people should know what they're getting into. As Eileen mentioned, we were in sort of a unique position where we did get an anchor investment by Eli Lilly, and while we still had positions that we had to think about timing and exit and whether it was the right decision for us. And so, as Eileen mentioned, we took several months to actually make a decision about whether this was the right move for each of us personally and together. There were a few things that I think were perhaps a little unique about our standing up of the fund, and a few lessons learned also. Just to give you sort of a sense of timeline, I ended up leaving my role at Bind in the summer of 2021, and I started getting us ready to launch a fund. And that involves a lot of operational aspects. It involves starting to talk to our investors to raise more capital so we could be a bigger fund, and starting to actually build a pipeline of deals that we could invest in. that really would fit in our thesis. We held the first close of the fund in February of 2022. And what that meant was we could go out and start investing, and we could start building our portfolio in this space, while also at the same time continuing to fundraise. And that, it's almost like having two full-time jobs. It really is. And so, again, as I mentioned, sometimes it's kind of good to not know exactly what you're getting into. But I think for people who are considering particularly venture capital raising, it is two full-time jobs, particularly in those early days. And then we actually decided to stagger our entry into Black Opal. Eileen had actually moved to London with In-Q-Tel and wanted to, I think rightly so, spend at least a year in London with In-Q-Tel and complete that commitment. And so Eileen joined the fund full time, although she was working a lot of nights and weekends at the time, in September of 22. And then, as you mentioned, we held the final close of the fund of this first vehicle in December of 2023, so almost 2 years after our first close. But in that time, we raised capital from some amazing investors, including Bank of America and JP Morgan, several health systems like Atlantic Health System and Henry Ford Health System, and a number of fund of funds, including Illumin Capital and Summit Venture Partners. So we have had an amazing group of investors who have provided their confidence in us. And at the same time, we have an amazing group of portfolio companies who also have given the confidence in us too, their confidence in us. We have 9 portfolio companies that span from diagnostics to delivery of care to data and analytics and life sciences. So a real spectrum of companies in our portfolio now.
Well, first, congratulations on the roster of investors. Very impressive group right there. And then tell me about these portfolio companies and what Black Opal is looking for in investments.
So when people ask us what we invest in, we try to keep it simple and tell them, and this is what we follow, that we have a 4D strategy underpinned by 2 C's and an A. MIT people, they like to shorten things either by numbers or acronyms, right?
Okay.
So 4D. 4D.
Yeah, I've never heard it put this way.
Yeah,
Okay.
we have a 4D strategy underpinned by 2 C's and an A. So I'm going to let Dr. Bishop talk to you about our 4D strategy, and I'll talk about the 2 C's and an A.
Excellent. I love it. Okay.
So the 4Ds are a way that allow us to actually start to segment and think about healthcare and life sciences. It's like massive industry, lots going on there. And how do we actually start to then think about where there's real opportunity and map our portfolio to those opportunity spaces and the problems that happen in healthcare. So the 4Ds really follow what is a typical patient journey. The first is diagnosis and prevention. So how can we use innovative technologies to diagnose and prevent diseases before we might even have them, or more accurately and more efficiently than we can do nowadays. And so we're looking for companies that are transforming the way we diagnose and prevent diseases. The second is around delivery of care. So how do we actually deliver care differently than we have been doing that? That may be virtual care, it may be remote monitoring, it may be even trying to change the burden of administrative work that happens in the delivery care system or the way we pay for healthcare. So this entire concept of how do we change delivery of care? The fourth area is really around the personalization and the impact of treatments in healthcare. And that may go all the way from, and the D is actually drug discovery and development, but how do we go from highly costly discovery of medications to more efficient, faster methods of doing that, to then actually getting it to the right patient at the right time. And so that D is really around drugs and discovery and development of therapeutics. And then the last D is actually a thesis that that we believe that data and analytics are going to be an underpinning and an opportunity in healthcare. There are vast amounts of data in healthcare and life sciences, and yet we tap into so very little of that right now. And so we invest in companies that are building that infrastructure layer around data and analytics that allow us to hopefully unlock the potential of all of that information in the healthcare and life sciences ecosystem. Now, we underpin that with these 2 C's and an A, and that really speaks to the tech side of the disruption that's happening because of technology. And I'll actually turn it over to Eileen to talk about the technology that drives all this innovation.
Yeah, so when we look back over our careers and sort of when we started at MIT in the 90s, we can see that the big transformations that have happened within the tech sector or within industries because of the tech sector happen when there are these inflection points in 3 areas, these 2 C's and the A. The first area, of course, is compute. Right. So when we were back at MIT, everything, even before that, you're talking about things happening in mainframes. I mean, we're a little bit younger than that, but mainframes, and then it went to PC, and then it went to mobile, and then it went to cloud. And what we see now that's happening is a move to the edge. So as you saw, I worked at ARM, and effectively you have what are compute resources normally being done in the cloud being sort of minimized so that they can run on edge processors. And knowing what that means is that an edge device, which could be used for diagnosis or monitoring or even treatment, is going to have a lot more compute in it. So we believe this move of edge compute, of TinyML, lots of, nerdy terms, is going to change the way that we diagnose, monitor, and treat patients. So the first thing is big change in compute. The second C is around connectivity. Again, if you think about the big transitions in terms of the big companies were created, the winners in tech, they happen when big changes in connectivity happen. So you went from 2G GPRS, or like dialing up with your AOL modem, right, to 3G, the invention of the mobile phone, to 4G, where you have like really fast downloads, the Netflix on your screen, to 5G. And now we are at the beginning eras of the evolution of LTE to 6G. And that's going to be yet another 10x increase in the end devices and almost 100x increase in connectivity speeds, which means things like remote surgery at real-time speed is going to be able to happen because you have the connectivity and infrastructure there. So you're talking about, again, compute and connectivity driving another revolution in technology, which can have a big impact on healthcare and specifically healthcare equity and outcomes. And then finally, the last one is around analytics, or what used to be called analytics. Now, of course, it's AI or advanced AI. And when we started with even Fialtis, this is before the generative AI became, household name and OpenAI and everybody saw it. We could see that ourselves. This transition from, this brute force training of AI models to some more sophistication and the ability to bring AI into the hands of people. Just like if you think about the internet era, when there used to be all these specialized website development firms in 2000, and you had to go to someone to get your website up, and then all of a sudden anybody could make their website and anybody could have a storefront on Amazon. That's what's going to happen, and we already see that happening in AI. Like there was a small group of people who knew how to do it. Everybody's going to get their hands on this. So like these large language models, and again, that gives them the power to affect their business. So that, and specifically in healthcare, you're now going to put tools in the hands of payers, providers, et cetera, that are going to allow them to focus on what they really should focus on, which is taking care of patients. So no more of this, 80% of my time is dealing with overhead because I'm going to have tools for AI. So compute, connectivity, AI should improve. What we found, however, is that there's always been this sort of rift maybe between the people who are building the technology and then them being able to navigate the healthcare industry, because it's a, as Tara mentioned. So it might exist, but either they don't know the people, they don't have the patience, or whatever it is to bring it into the industry. And that's why we're trying to collide these two worlds to make a difference.
That is fascinating. Yeah, that's fascinating. Just the way you broke that down is so, I've never heard investing partners break it down in such a clear, concise manner that's so easy to understand. And that's exactly what's needed, right? Like, we all see all these technological, incredible advancements, and then you go into the healthcare world and it always seems, I hate to say this, far behind, right? I mean, right? Like,
it's fine.
Yeah. So, and you must be so excited about the possibilities of bringing that to health. It's so needed, and you could really change the world, change lives. We're getting close on time, but could each of you share maybe something you're excited about that you're seeing an investment, and then you don't have to name names, or I know you have to keep things private, but just maybe what you're excited about. And then I want to let the listeners know how they can find out more information about Black Opal, but that would be great. That was fascinating.
So I can chime in there first,
Okay.
and let both of us to be able to, I think we both have things
yes,
we're very
please.
excited
Yes.
about. So first of all, I think there's a few things at just macro level that I'm excited about. Kate, it's fine for you to say it feels like healthcare is still in the dark ages.
Okay.
I mean, it is an industry that
Okay.
still uses fax machines.
Right.
And there's so much opportunity. I think what excites me about healthcare right now, and I think why the timing feels right, is we have seen some things that have demonstrated our ability to actually pivot and change very quickly. I think COVID, for example, allowed us to understand, how do you change an entire delivery system that was providing care in brick and mortar practices to a whole different way of doing that. And I think for many of us who have lived and breathed in healthcare, maybe it did take a global pandemic to actually open our eyes to actually, there's different ways to do things. And I think that's a really important sort of market driver. I also think this concept of AI and the fact that it is now, as Eileen mentioned, not just in the hands of a very few specialized practitioners, but it's coming into every part of our world. And when I speak with other physicians and healthcare administrators, there is a sense that we can't miss out on this. It is if we miss out on this, we are going to miss out on a massive wave of evolution. And so these concepts of how is healthcare ready and now is actually, for me, very exciting. Having worked in a world and having done much of my work to improve healthcare, it actually feels like we're at a really important time in healthcare to have change. The other thing is, I'm super excited about our portfolio and the kinds of companies that are really bringing together technology and really innovative technology into the healthcare ecosystem. For example, we have an investment in a company that has wearable technology that was developed out of MIT. It's a company called Empatica that allows us for the first time to monitor things that were very hard to monitor in healthcare. Things like stress, depression, pain, where we'd have to ask questions. It'd be very subjective. And yet there's such important sort of markers of how someone is doing that can now be quantified in a way that we never could quantify before. We have an investment in a company that is transforming the way we diagnose lung cancer, the largest cancer killer in the world. And if we can just even save some lives from early detection, can change and transform the lives of many people. So those are the kinds of companies. They're really using this innovative technology, but really having impact and use cases and solving problems in healthcare. So that's what excites me about this space. And I'll turn it over to Eileen to share some of her perspectives.
Okay.
Right. So as you heard, I was for 6 years with InQtel, which is the non-for-profit venture capital firm associated with the agency. Now, why was InQtel created? Well, one of the reasons why is because there was this realization that people trying to really give policy recommendations were spending kind of 80% of their time figuring out how to put the data into a format that they could use to then figure out the end. So again, a lot of overhead. And when I go into a doctor today, like maybe all of you, I just see so much overhead. I usually have to go in, I have to write a form, they ask me 1,000 questions again, and then I just do not understand why there's so much overhead, which of course Dr. Bishop always tells me why. But what I'm excited about is that same overhead was there in the agency 10 years ago. And with the help of all these innovative startups from Graph, we have a graph database company called Tiger Graph. So the agency uses graph databases to better analyze the 1,000 points of data they have. We have a conversational AI company called Hyro. So the defense intelligence agencies use, natural language processing, again, as a mechanism for monitoring conversations and for sort of multiplying their abilities. So I just am so excited about effectively taking what already worked or has worked in a different industry, in my case, defense intelligence, to help analysts, to help doctors, no code platforms. So that they, even on the sort of digital twin and optimization side, all the tools that exist already today just need to find their way into this industry. And it is very hard to maneuver. And that's why it's so important to have a partner that has the expertise in the industry. That's why, we decided to do this, and it makes sense to do this now. So that's just, for me, very excited about the infrastructure. The next thing that I will say is I'm just also excited about what I see as a revolution in terms of the way that we discover and make drugs. When I started, you heard, I started my semiconductor career in a startup in 1997 when people were, they were trying to optimizing chips and semiconductors, et cetera, using very manual methods, sort of brute force methods, not very efficient. The startup I was at did a digital twin. And then from then on, the industry evolved, and you don't see kind of manual labor being, that's the only way we can get that many transistors to a chip and this small in your phone. It had to move forward quickly. And what I'm excited about on the bio side is when I look at how things are today, it reminds me of the 90s in semiconductors. It's sort of still manual. A lot of people with pipettes moving things. Yeah. Not a lot of automation. Not a lot of improving of yield. Right. And unfortunately, that's what keeps prices high. Right. That's what keeps drugs out of the hands of normal people. Just like if we were to keep things that way, then there would only be one computer, and it would be, we'd never have a phone that's like $50 and this is a supercomputer. We had to automate things and make it cheaper. So the second thesis for us is around, indeed, this drug discovery, delivery, distribution. How do you put in automation from, let's call it the semiconductor industry or any other industry, into the tech bio industry, so we can bring the cost down so that everybody gets to live and have access to drugs, not just wealthy people. That's the two things I care most about.
Wow, incredible. I mean, you both have me excited because I feel like this is an area where there's, like you were saying, there's so much potential, so much progress, and we all have personal stories, right, of loved ones who were just too early, right? And there's all this change coming and possibility. And what you've talked about today is very moving. And, the work you're doing is very moving too. Thank you both for being here. Where can I go to find more information about Black Opal Ventures? If one of you could let us know, that would be great.
So we have a website. So please see our website. You'll see ways to contact us on the website. And you'll also see a little bit about our story and our thesis. Very soon we'll be adding the portfolio. So you'll see the companies that we've invested in also. And then we're on LinkedIn, very active there. So connect with us on LinkedIn. And then, we are out and about. So we love to see people at conferences and industry events. It's always lovely to be able to connect to people in person and outside of the virtual world. So lots of ways to connect. And we love hearing about, as Eileen mentioned, highly innovative companies and technologies that are really solving important problems in healthcare.
Yeah. Thank you. Thank you both for being here. Yeah, thank you. It was a fascinating conversation. I learned a lot. So really appreciate your time. Thank you so much.
Welcome.
Thanks, Kate.
Thank you, Kate.
You've been listening to Startup Success. To make sure you don't miss out on future episodes, subscribe to the show in your favorite podcast player. Like what you hear? Tap the number of stars you think the show deserves in Apple Podcasts. For more tools and resources for your own startup success, check out birkelandassociates.com. Thank you so much for listening. Until next time.